now introduce our community activist, Ron Swanda. And after retiring from a career in government relations in 2007, Ron Swanda found that recreational activities normally associated with retirement were not fulfilling. He realized that retirement could be my time, providing opportunities for community service that were simply not feasible while working full-time. Seeing the many challenges faced by seniors and seeing that disadvantaged seniors were often underrepresented, he became a volunteer advocate for seniors in D.C. Many D.C. organizations now recognize Ron as a steadfast voice for seniors. He's a member of numerous government and non-governmental advisory organizations. Working with the D.C. Health Department, Ron encouraged development of a soon-to-be-announced HIV prevention program for seniors. In 2011, D.C. Mayor Vincent Gray named Ron D.C.'s HIV Advocate of the Year and appointed him to the D.C. Commission on Aging. Ron Swanda.
Thank you. Thank you. I feel like I'm talking to my friends, although I don't know all of you, but believe me, it's a pleasure to be here, partly because when I became positive in 1989, I tested positive at Whitman-Walker Clinic. And back then, things were totally different. There was a different world in many ways, and I won't go into all that. But I want to tell you that I'm still here. I don't know why I'm still here.
And still queer.
And so when I retired in 1997, as the introduction said, I looked around and realized that retirement activities were not what I really wanted. I needed something more fulfilling. And I walked into some of the senior services around the city, and I was absolutely flabbergasted to find out that not a one of them had anything about HIV on the wall. And I realized that there was a great opportunity for somebody to scream out and say, look, pay attention to these seniors, mostly were heterosexual seniors, who are getting infected with HIV, and nobody was there to talk to them, talk to somebody about them. So this became gradually, you just kind of get your foot in the door of a cause, and it kind of starts to snowball, and that's kind of what's happened to me. And so, but I can tell you that, and there's actually some recent study in the Journal of Gerontology that points this out. There's scientific evidence that if you keep your mind active and involved in things you care about, you're going to stay healthy longer. And there's scientific evidence of that. It's not just anecdotal as it is now. Now, active and involved and having fun is not the same for me as it might be for everybody else. I think it's fun to go to a city council meeting. I'm crazy. But, other people may want to go to Mexico in the summer. I know people like that here too. And other people may want to belong to various social groups. So I think if there's one message I could think of to convey to all of you from the many experiences I've had, it would be that your senior years can really be fun and active. You don't necessarily have to be someone who's worried about feeding yourself and housing, etc. Now that does happen. But I must tell you, the other thing I learned since I retired is there are a tremendous amount of resources in this city that can help people that have shortages of services. You have a directory from the Office on Aging. Courtney, if you raise your hand to me like this, he's from the Office on Aging, and that directory has just about anything a senior can ask, including many seniors find themselves the caretaker for their mother or father. So if you're one of those caretakers, they have respite programs. They have people that can help you with the home care while you're at work. If your mother or father has to need some care at home, they can arrange them to go to a senior daycare center. And I have had a tremendous intellectual journey understanding, and it continues to this day, about all the services that are available, including out and out money to get, if you can't pay your rent this month, there are people that can help you with that. There are people who provide services to come into your home. And if you are a low income person, there are people that can help arrange for that to be paid for through Medicaid. The people I worry about the most, I don't worry about the quite wealthy people because they can buy whatever they need. I worry about those kind of people in the middle, which is kind of like me. I just went on Medicare, and it was a rude awakening to find out how much my HIV medications were going to cost me on Medicare. Holy mackerel, $1,000 for one medication for 1 month. That was a real shock. Now, fortunately, because of the change, it's really complicated, but I won't go into all that. But fortunately, it's going to get better as I go through the donut hole, the donut hole. But I also want to point out that there are getting qualified for Medicare for me was an absolute puzzle. I'm a relatively intellectual person, but it was an absolute nightmare. I could not figure out what the heck was going on. But I found out after the fact, after I struggled through it the first time by myself, that there are services here in town that are paid for by the Office on Aging that will counsel you on how to sign up for Medicare, to know the difference between Medicare and Medicaid, what's Medicare Advantage. And I also learned that our city is among the most advanced cities in the country to reform its healthcare system. You've all heard about Obamacare. It's really called the Affordable Care Act. This city is ahead of almost any city in the country implementing that. And there are tremendous advantages to people that are HIV and to LGBT people. For instance, pre-existing conditions, you can no longer exclude them by an insurance company. Your children can be insured under Medicare now for longer than they could have in the past. So there, and as we convert totally to a new system called the exchange, the 7% of people in our city who do not have health care coverage, 93% of the people in D.C. have health care coverage either through their employer, through Medicare or Medicaid, or through a thing called the Alliance, which is you don't have to know exactly. But there's still 7% of people don't have insurance, and there's lots of reasons for that. But in the future, there will be a after we get this exchange going, it will be a way for all of you to sign up to get individual policies, or perhaps more importantly, if you're the owner of a small business, or if you have a small business, you'll be able to go in and get affordable health care for you and all your employees for a very small group of people. And there are lots of people in the D.C. government, some very smart, dedicated people that I run into. It really inspires me to think that they're working on my behalf and on behalf of the less advantaged people in this city. And frankly, I have to give our mayor a plug because I think he's working hard at it too. So not everything in this city is perfect, but it's working the right way. And I really please ask, after having my name in the paper of the Blade, and about a year ago I was published in the Beacon, which is a senior newspaper about being an HIV positive senior. So there's no secrets in my life anymore. So please don't be afraid to ask a question. Thank you.
Thanks, Ron.